that the really, really, really big fight that we had over the last year was over health care. Now, there are a lot of things to talk about this health care bill, but you all have heard a lot about it. But this is a government takeover of our health care system. There's no ifs, ands, or buts about it. 160 new mandates, commissions, bureaus, we estimate will require at least 22,000 new federal employees. And why? Well, because they want to control everything. They really want a single-payer national health care system. They couldn't get that. They wanted their public option to drive everybody else out of the business. They couldn't get that. But let me tell you what, they got everything else. They have the whole bureaucracy, everything they need in order to take total control of our healthcare system. Do you realize that within 5 years, every single health policy in America will have to be rewritten and approved by the federal government, the new health choices czar? Every single policy sold. All employer-provided health insurance, all those plans that have already been approved, have to be reapproved by the Department of Labor and the new health choices czar. Every policy sold at these so-called exchanges is going to have to be approved. They may be sold by a private sector firm, but the plans will be designed and approved by the new health choices czar. And all of the policies that everyone's going to be mandated to purchase, again, all have to be approved by the health choices czar. Now, I have never seen anything quite as bizarre as this. There's no question that our healthcare system needs reform. But the American people were telling us all the last year, the number one issue is driving down the cost of healthcare and health insurance in America. And there is absolutely nothing in their 2,700-page proposal that is going to reduce the cost of healthcare in America. As a matter of fact, I'll argue that most of the things they do in their plan is going to raise the cost of health insurance in America, raise the cost of healthcare in America, which means that people are going to end up getting less. But we had a whale of a fight. But it's the only time in my entire political career, that I saw the Congress of the United States pass a bill that the American people knew about and had said no to. Now, you understand how this works. When the American people speak up, their Congress listens. And that's the way it's supposed to happen. But the American people spoke loudly, clearly. They wanted no part of this. But the left was so committed to this political objective that they would leave nothing in their way. You know, all those people who showed up last July, August, September at those town hall meetings all over the country, the president and the speaker called that some grass tops operation, manufactured by Republicans. I wish we were that good. The election that went on in New Jersey and in Virginia in November. Oh, well, we had bad candidates. You know, it really wasn't a reflection on what was happening in Washington. Even when Scott Brown won in Massachusetts, oh, well, we had a bad candidate. You know, it was a special election. Anything could happen. And yet, the louder the American people spoke, the more determined they became to continue to march ahead. I have never seen the legislative process tortured, abused, bought off, paid for, bribed in order to pass this massive government control of our healthcare system. I've never seen anything like it. And the American people haven't seen anything like it either. And as a result of all of this, you've watched this political rebellion growing in America. When I left here a year ago, I went over to Bakersfield, California, to do an event for my colleague Kevin McCarthy. And right before the event, it was April 15th. They were going to have a little tea party down at the courthouse, and I suggested to Kevin we ought to stop by. They were expecting a couple hundred people. So we went down there, and they had several thousand people there. And I've been to my share of tea parties. We had one Labor Day weekend in Westchester, Ohio. 18,000 people on a Saturday afternoon, Labor Day weekend. And I've been around these crowds. I'll tell you a few stories about them. Over here in Bakersfield, all these groups. You got a few Republicans there. You've got a few Democrats there. There are always a couple of anarchists who want to kill all of us. But 75% of the people who show up at these events are normal, everyday Americans who've never been involved. Something finally struck them and drove them off of their couch, out of their easy chair, and into the street. Right before the health care vote, I had 38 Tea Party folks from my district, northern part of my district, north of Dayton, who came to my office. I looked around, I had a meeting with this group, and I looked at all of them. I've never seen one of them. Never met one of them. And the thing you have to remember about the Tea Party crowd is that they're the tip of the iceberg. You know, most of the iceberg you never see, it's below water. These are the people who got off the couch and out of the chair and in the street. But they represent tens of millions of other Americans who are just as concerned, just as frightened about what's happening in Washington, just haven't quite taken to the streets yet.